If you're over 65 and still forcing yourself to walk every day, this may surprise you. 3 gentle exercises could protect your strength, balance, and confidence better than walking alone. Most adults over 60 have been told the same thing for decades. Just walk more. Walk for your heart. Walk for your joints. Walk to stay young. And walking is helpful. It's familiar. It feels safe. It gets you moving. But here's the quiet truth. Many seniors are discovering the hard way. Walking alone does not protect you from muscle loss. It does not fully protect balance. And it does not stop the gradual weakening that makes everyday tasks harder each year. Think about this for a moment. You may walk every morning, yet still struggle getting up from a chair. You may walk around the block, yet feel unsteady on stairs. You may walk daily, yet notice your legs feel thinner, weaker, or tired sooner than before. That's not because you're doing something wrong. It's because aging changes how the body responds to movement. After 60, the body quietly loses muscle and strength unless it is gently challenged. Not punished. Not pushed to pain. Just reminded to stay strong. Walking is mostly forward motion. Same muscles, same rhythm, same demand. Over time, your body adapts and stops improving. This is where many seniors feel confused and discouraged. They think, I'm doing what I'm supposed to do. Why do I still feel weaker? The answer is not more walking, and it's definitely not intense workouts or gym machines. According to many orthopedic surgeons and physical therapy specialists, adults over 65 benefit most from movements that do 3 specific things. They gently load the muscles, they challenge balance in a safe way, and they activate muscles walking barely touches. When those 3 needs are met, something powerful happens. Legs feel steadier. Steps feel more confident. Daily movements feel easier again. And no, this does not require long workouts, sweating, or floor exercises. In fact, some of the most effective movements can be done at home, using a wall, a chair, or your own body weight, often in just a few minutes a day. Unfortunately, many seniors never learn these movements. They keep walking faithfully year after year, while strength quietly slips away. And by the time balance feels uncertain or getting up feels difficult, they assume it's just age. But it doesn't have to be that way. There are 3 simple, surgeon-approved exercises that focus on what walking misses. They are gentle, they are realistic, and they are designed specifically for bodies over 65. In a moment, I'll explain why these exercises work when walking alone does not, and why so many older adults feel stronger within weeks of doing them correctly. But first, you need to understand the single biggest mistake well-meaning seniors make when trying to stay active after 65. For many adults over 65, walking feels like the safest choice. It's simple, it's familiar, and doctors have recommended it for years. But aging changes the rules. After 60, the body naturally loses muscle faster than it did before. This process is slow, quiet, and easy to miss at first. You don't feel it in one day. You feel it over years. Muscle loss doesn't just affect strength. It affects balance. It affects posture. It affects how stable you feel when you turn, step back, or rise from a chair. Walking helps the heart and lungs, but it uses the same limited group of muscles in the same way every time. That's the first problem. The body is very efficient. If a movement does not challenge muscles, they stop adapting. Walking becomes maintenance at best. The second problem is balance. Most falls do not happen while walking forward on flat ground. They happen during transitions, standing up, turning, reaching, stepping sideways, climbing stairs. Walking rarely trains these movements. The third problem is what surgeons and therapists call support muscles. These are the deep muscles around the hips, thighs, and ankles that stabilize you. They weaken silently with age, and walking barely activates them. Now, let's talk about the most common mistakes seniors make. Not because they're careless, but because no one explained this clearly. Mistake number 1. Believing more walking equals more strength. Longer walks do not equal stronger legs after 65. They often lead to joint strain without improving muscle support. Mistake number 2. Avoiding muscle work out of fear. Many seniors worry that any form of strengthening will cause pain or injury, so they avoid it completely. In reality, gentle muscle activation is one of the safest things you can do when done correctly. Mistake number 3. Thinking balance loss is inevitable. Balance can improve at any age when trained safely. It is not just luck. It is a skill supported by muscles and nerves. Mistake number 4. Waiting until something feels wrong. By the time weakness is obvious, confidence has already dropped, and fear of falling grows. This is why many surgeons now emphasize preventive movement, not just activity. They focus on small, controlled exercises that activate unused muscles, improve joint stability, restore confidence in everyday movements. And here's the reassuring part. These movements are not workouts in the traditional sense. They are not exhausting, they are not painful, and they do not require equipment. They simply remind the body how to support itself again. When done daily, even for a few minutes, they send a powerful signal to aging muscles. You're still needed. That signal matters, because muscles respond to use at any age. They don't need intensity. They need consistency. In the next part, I'll walk you step by step through 3 surgeon-approved exercises that are often considered more effective than walking alone for adults over 65. Each one is safe. Each one is realistic. And each one targets something walking misses. Do them correctly, and many seniors notice better balance, stronger legs, and more confidence in everyday life. These exercises are not about pushing your limits. They are about waking up the muscles that protect you. Do them slowly, do them with control, and always use support when needed. If anything feels painful, you stop. Discomfort is not the goal. Let's begin. Exercise 1. The supported chair, sit to stand. This is one of the most important movements for adults over 65. It trains the exact muscles you use to get out of a chair, off the toilet, and out of a car. Walking barely touches these muscles. How to do it? Stand in front of a sturdy chair. Place the chair against a wall so it doesn't move. Stand with your feet about shoulder width apart. Keep your chest upright. Slowly lower yourself down until you lightly touch the chair. Do not drop. Then gently press through your heels and stand back up. If needed, place your hands on the chair or armrests for support. Key points. Move slowly in both directions. Exhale as you stand. Do not rush. How many? Start with 5 repetitions. Rest. Work up to 10. Why this matters? This movement rebuilds thigh and hip strength. It improves stability, and it directly reduces fall risk during daily transitions. Exercise 2. Wall-supported heel raises. This exercise strengthens the lower legs and ankles, key areas for balance. Weak ankles are one of the biggest contributors to unsteadiness. How to do it? Stand facing a wall. Place your hands lightly on the wall for balance. Feet hip-width apart. Slowly rise up onto your toes. Pause for 2 seconds. Then slowly lower your heels back down. Control the movement both ways. Key points. Keep your knees soft. Do not lock them. Stand tall. How many? Start with 8 repetitions. Build up to 15 over time. Why this matters? This strengthens muscles that stabilize you when stepping, turning, and catching yourself. Walking does not train this pause and control motion. Exercise 3. Standing side leg raises. Hip stabilizer exercise. This is one of the most overlooked exercises for seniors. It activates the muscles that keep your pelvis stable when you walk or stand on one leg. How to do it? Stand next to a chair or counter. Hold lightly for support. Stand tall. Slowly lift one leg out to the side. Keep toes pointing forward. Do not lean. Lower slowly. Then switch sides. Key points. Small movement. Controlled lift. No swinging. How many? 5 repetitions per side. Build to 10. Why this matters? Strong hip stabilizers reduce side-to-side wobble. They protect your knees and lower back, and they dramatically improve balance. How to use these exercises? Daily, you do not need a long session. 5 to 10 minutes is enough. You can do them after waking up, before lunch, or while watching TV. Consistency matters more than effort. Walking can still be part of your day, but these exercises fill in what walking misses. They remind your body how to support itself. In the final part, I'll explain why it's never too late to feel steadier, stronger, and more confident, and how small daily habits can change how your body ages. If you've ever thought, "I wish I had started earlier," you're not alone. Many adults over 65 believe they missed their chance. They assume strength and balance only belong to younger bodies. That belief is understandable, but it isn't true. The human body responds to gentle challenge at any age. Muscles don't disappear because of age alone. They fade when they are no longer asked to help. The moment you begin asking them again, even softly, they respond. What matters most is not how hard you exercise. It's how regularly you remind your body that it is still capable. These 3 exercises are not about perfection. They are about restoring trust in your body. Trust when you stand up. Trust when you turn. Trust when you take a step without hesitation. That confidence changes everything. You move more. You tense less. You live with less fear of falling. And fear is often what limits seniors the most. Not weakness, not age, fear. By choosing gentle, supportive movements instead of forcing yourself through long walks alone, you're working with your body, not against it. You're giving your joints support. You're giving your muscles a reason to stay. And you're giving your nervous system reassurance. Progress may feel subtle at first. A steadier step. Less hesitation. Standing up feels easier. Those small changes matter. They compound over time. A few minutes a day becomes weeks. Weeks become months. And months become a stronger, more stable you. There is no finish line here, only momentum. If walking brings you joy, keep walking. But don't let walking be the only thing you rely on. Support your body where it needs it most. Start slowly, stay consistent, and be patient with yourself. Your body has carried you for decades. It deserves care, not pressure. And remember this: it is never too late to build strength. It is never too late to improve balance. And it is never too late to feel more confident in your own movements. Begin today, just a few minutes, right where you are. Your future self will thank you.